Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how our communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, how to create a training around it or add it to trainings that are already being held. And to date, we've held over 20 virtual screening events. We've engaged thousands of participants, and we look forward to hosting many more of these events in the coming year and engaging new countless participants. This morning, we are thankful for you, our amazing CADCA members and guests, and we're specifically thankful to today's co-hosts, Holly Jort and the Montana Public Health Institute. Before I kick off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in Montana who are working every day to save lives. We are honored for them to be part of this event. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how to use this technology to better save lives and create a norm that every life is worth saving. Now, I am pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined our team in 2021 and has been working ever since to help further CADCA's mission of building and maintaining safe and healthy drug-free communities. We're thrilled to have him with us here at CADCA, and we appreciate him being here today to speak with us. Valentino?
Thanks, Reiko. It is such a pleasure to be here for this important event. Before we begin, I want to personally thank Walmart for their investment in this technology and in the people who will benefit from this life-saving training. I'd also like to extend a special thanks to our friends and supporters at the Montana Department of Public Health and Human Services, and today's co-host, Montana Public Health Institute. In June of 2022, myself and other CADCA staff visited Billings, Montana, in particular Little Bighorn, for a leadership retreat. We enjoyed our visit and engaging with the fellow Montanans. It's an honor to be on with such a great impressive leaders from the great state of Montana. Finally, I want to thank everyone on today's webinar. We hope this unique event will prepare you on how local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 coalitions. We have sought to build, train community residents and leaders to build and develop coalitions in the communities and reduce substance misuse by adapting CADCA's model for community change. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. Prevention has become more important than ever. Recently, the CDC reported that over 109,000 drug overdose deaths occurred in the United States in 12 months ending March 2022. This is the largest number for a 12-month period ever recorded. To put it in perspective, that number is nearly the population of the entire city of Billings. Sadly, it is estimated that the number will increase. This is tragic, and we have to do our level best to right this ship. Together we are stronger, and as we train substance use and misuse prevention to coalitions every day of the year, across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will provide unachievable. You are the true heroes in your communities. The conversations being had on this webinar is not a unique one. Our partners at the Drug Enforcement Administration recently launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. At CADCA's 2023 National Leadership Forum, DEA Administrator Ann Milgram shared, "This is not a war on drugs, but a fight to save lives. Let it be known, if you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. I want to encourage you to keep up the great work you're doing. I look forward to seeing you in person next time we are all together. Thank you for having me on today. Back to you, Rico.
Thank you, Valentino, for those remarks. We appreciate you joining us. And now it is my pleasure to introduce our first speaker. We are excited to introduce you with Kai McBride. Kai McBride grew up in Helena, Montana, and is the Opioid Prevention Program Manager for the Behavioral Health and Developmental Disabilities Division at the Montana Department of Public Health and Human Services. Kai has worked on the State Opioid Response Grant for the past 3 years. Her focus is on the implementation of prevention and recovery activities, including the opioid education and naloxone distribution program. Kai has over 10 years of experience working with behavioral programs for youth and adults in Medicaid and housing and urban development funded programs. We turn it to you, Kai.
Hello, my name is Kai McBride, and I am the Opioid Prevention Program Manager with the Department of Public Health and Human Services in Montana under the Behavioral Health and Developmental Disabilities Division, working on the State Opioid Response Grant, which is the funding stream that supports all the great work that you're going to hear about today. I wanted to start with a little bit of the history of the State Opioid Response Grant. Montana is in its third iteration. As you can see, the programs have evolved and the state has expanded its efforts. Since Montana has passed a standing order in 2017 to support the distribution of naloxone, access has increased from being primarily for first responders to agreements with community organizations, to opening an online order form for all to order, with secondary distribution for people who use drugs as something that's promoted. This has been an important factor in addressing what used to be an opioid prescription crisis, but is now a fentanyl crisis. All other SOAR activities have had similar success, but historically, these different programs have been a little bit siloed. To ensure that people who use drugs and those who are most likely to witness an overdose are aware that naloxone saves lives, but is not the long-term solution, state opioid response programs are collaborating to work within a continuum to increase targeted outreach efforts and to raise awareness of resources for prevention, harm reduction, treatment, and recovery services statewide. There are many contractors funded through SOAR, and the number is growing as the landscape of opioid work evolves. Under the current iteration of SOAR, these contractors will work together to support people who use drugs in finding recovery. You will soon hear from two of our primary prevention contractors, Montana Public Health Institute and Kaufman and Associates, and how their work will help connect to this continuum. This work is important. As you can see, we not only do we have a lot of contractors, but we also have partnerships with other state agencies and different technical assistance organizations that are supporting this work in Montana. The state continues to see a spike in fentanyl-related overdoses and fatalities. However, it's important to also remember that the work that you're doing and the work that all of our contractors and stakeholders and partners are doing really are saving countless lives. This work is real time, and the work that you do to contribute to saving lives is pretty amazing. You're on the ground, and as we continue to implement services under SOAR 3, your involvement is just going to continue to be that much more important. So thank you for your time today.
Thank you so much, Kai, for speaking with us today, for the tireless work you Montanans have done throughout the state and in your communities. We appreciate you sharing your time and expertise with us today. Next, I would like to introduce you to Victoria Traeger. Victoria began working as an epidemiologist at the Montana Department of Public Health and Human Services in 2017. She uses a variety of data sources, such as hospital admissions, emergency department visits, death certificates, law enforcement, and emergency medical system data to track fatal and non-fatal overdoses across the state of Montana. Her other areas of focus include violent deaths and elderly fall prevention. She has a Master's of Science in Public Health from Emory University. Victoria, thank you so much for joining us today.
Hi, my name is Victoria Traeger, and I'm an epidemiologist at the Montana Department of Public Health and Human Services. Part of my job is to attempt to quantify the effects of opioids and other substances on Montanans. Drug poisonings are the fourth leading cause of injury-related deaths in Montana, after motor vehicle crashes, firearm deaths, and falls. Between 2009 and 2019, Montana was one of the few states in the nation with declining drug overdose death rates. However, in 2020, a decade's worth of progress was undone in a single year, driven largely in part to the increase in deaths due to synthetic opioids, such as fentanyl. While our death rate due to opioids is lower than that of the rest of the nation, there are still between 150 to 200 Montanans dying each year of an overdose, and these were all preventable deaths. Along with this, we see nearly 2,000 Montanans visiting emergency departments each year due to drug poisoning, with around half of these due to an opioid. Montana hospitals charged almost $5 million in opioid-related hospitalizations and emergency department visits in 2021 alone. One of my tasks as an epidemiologist is utilizing an effective surveillance system to track and respond to drug overdoses in real time. I use data collected from emergency medical services in conjunction with law enforcement reports to identify opioid overdoses across the state. Using tools called Biospatial and ODMAP, I have certain alert thresholds set, which automatically notify me if a specified number of opioid overdoses occurs within a specific time frame in a specific geographic area. Montana has some counties that are incredibly rural and others that are much more populated, so these alert thresholds vary from county to county. For some, seeing 2 overdoses in a single week is a cause for alarm, and in others, we're alerted if there are more than 5 overdoses in a single day. Once I get an alert, my colleagues and I at the Public Health Department work to verify if an overdose spike is actually occurring. We have built relationships with local partners over the years and rely on them to help give us a better understanding of what is happening in their area. I read through the EMS narratives, confer with local law enforcement, and reach out to community coalitions that focus on overdose prevention. If we determine that this is a legitimate spike, we begin sending out warnings to health providers in the area. For example, we notify ambulance services to have a high index of suspicion for an opioid overdose and to remind them to make sure that they are stocked up on naloxone. One of our tools at the state is the dissemination of a HAN, a Health Alert Network document. It is a method of sharing validated information about healthcare concerns and emerging threats with local public health departments, tribal health agencies, public information officers, federal, state, territorial, and local health practitioners, clinicians, and laboratories. Since our first HAN was released regarding the identification of overdoses due to fentanyl in 2019, we have sent out 5 more of these alerts regarding fatal and non-fatal opioid overdoses across the state. For more information on substance abuse in Montana and more data reports, please visit our website. Thank you.
Thank you, Victoria. It's fascinating to learn about the state surveillance efforts that help keep our medical services prepared and our communities informed. Your work is such an important piece in preventing loss. Thank you so much for being here with us today. Next, I'm so pleased to introduce Katie Loveland. Katie has facilitated the Montana Substance Use Disorders Task Force since 2016. She brings over a decade of experience working with programs in Montana, including numerous projects with state, local, and tribal agencies designed to assess needs, evaluate programs, and optimize operations. Her areas of expertise include mental health, substance use, chronic disease, human services, and evidence-based practice. She has a master's degree in social work and a master's degree in public health from the University of Michigan. Katie, we're excited to hear from you.
Hello, my name is Katie Loveland, and I facilitate the Montana Substance Use Disorders Task Force on behalf of the Montana Department of Public Health and Human Services. The task force has been around for a while. We first convened in the fall of 2016 with funding from the Centers for Disease Control and Prevention. We're now funded by CDC's Overdose Data to Action grant, and we meet 4 times a year. We've engaged more than 250 individuals so far in our coalition. representing more than 135 organizations statewide. We tend to meet in Helena, but we have a virtual option so that people can engage from all around the state. In the spring of 2017, we published our first statewide strategic plan for addressing substance use in Montana. The plan was updated in 2020, and it's available at dphhs.mt.gov/opioid. The Montana Strategic Plan seeks to promote comprehensive strategies to reduce substance misuse and abuse and promote well-being in our state. The overall goal of the current strategic plan is to reduce drug-related morbidity and mortality across all populations in Montana. We have a bunch of focus areas of the plan. We try to be really comprehensive and include strategies from partners across the state. So we focus on the areas of partnerships, surveillance and monitoring, prevention, treatment and recovery, harm reduction, and enforcement and corrections. Under harm reduction, we have a bunch of strategies to promote naloxone distribution and use in the Big Sky State. Some of our strategies for naloxone that are included in the current plan include providing online and in-person naloxone training statewide, establishing a master naloxone trainer in every single county in the state, placing naloxone in automated external defibrillator kits and providing training on how to use those kits, encouraging co-prescribing of naloxone with opioids, encouraging initiation of medication-assisted treatment in patients who receive naloxone for an overdose, encouraging naloxone distribution by pharmacies utilizing the state standing order, and finally, developing systems to really track naloxone use statewide, especially for our law enforcement and first responders. So we published the plan in 2020, and we've really made strides to implement each of those listed strategies, and actually a lot more strategies to distribute naloxone through the work of our committed partners. In the coming year, our task force is going to reconvene and update the strategic plan again, and we will include additional evidence-based strategies related to promoting naloxone use statewide. If you are a partner engaged in this work, if you're working to reduce overdoses in the state of Montana, you're invited to join our task force. We are a group that is really open to new partnerships, and we want to share this information with as many folks as who are working on the topic. So please email emma.perry@mt.gov, and we will add you to the invite list. We hope to see you at our next task force meeting.
Thank you, Katie, for helping us understand how this work engages with key players across the state and for how this work fits into the larger picture of helping Montana be free from substance use. I'm now excited to introduce and tell you that we're joined today by Anna Whiting-Sorrell and Michaela Holm from Kaufman and Associates. Kaufman and Associates is helping build Montana's overdose education campaign while ensuring that it is a campaign that speaks directly to Montana and broaches critical topics. Anna Whiting-Sorrell brings decades of experience in promoting public health policies, programs, and services for tribal nations and all Montanans. Anna currently serves as subject matter expert for Kaufman and Associates, Inc. on a variety of projects, including Indigenous recovery from the COVID-19 pandemic and building strong tribal public health systems. Sorrell worked as a high school teacher and at many positions within the Confederated Salish and Kootenai tribes, where she is an enrolled tribal member. She has held several notable positions across Montana, including the roles of Health and Family Policy Advisor for the Governor's Office of the State of Montana, the Director of the Montana Department of Public Health and Human Services, the Billings Area Director of Indian Health Service, where she oversaw the delivery of healthcare to more than 65,000 American Indian and Alaska Native residents on 7 reservations in Montana and 1 in Wyoming, and provides guidance to 5 urban health programs. Throughout Sorrell's celebrated career, she has helped those finding their voice, building strong families, communities, and tribes. Her work ranges from safeguarding basic rights, protecting children, and improving access to quality healthcare to teaching and working with clients as they build their services. Most importantly, Anna is wife, mother, and Yaya, Salish for grandmother and grandchild, to Esther and Jonathan. Michaela Holmes serves as project manager for Kaufman Associates communication team. She brings more than 6 years of experience in supporting outreach and education efforts in public health promotion. Michaela specializes in project coordination, meeting facilitation, marketing, strategic plan development, implementation, and education. Michaela has worked with the Montana Department of Public Health and Human Services over the past 2 years on communication campaigns for medications for opioid use disorder, or MOUD. The campaign continues to evolve into statewide efforts. Anna and Michaela, thank you so much for being here with us today, and we are really looking forward to hearing from you.
Hi, everyone. I'm Michaela Holm. I work with Kaufman and Associates and have been contracted with DPHHS to do some of the related opioid work. And here I'll let Anna introduce herself as well.
Hi, I'm Anna Whiting-Sorrell, and I also work with Kaufman and Associates. It's an Indian-owned company that does work that matters all across the United States.
Thank you. We have been working with DPHHS regarding opioid use and campaign materials for the last 2 years. And this year, we really wanted to combine all statewide efforts to develop and design a whole statewide campaign that relates to medication for opioid use disorder, naloxone distribution, and really trying to create a more streamlined statewide campaign. So we've started a few months ago with a contract with DPHHS. And our first step was to do stakeholder meetings. And we weren't able to do one whole stakeholder meeting just with scheduling. So we ended up doing a total of 7 stakeholder meetings. 5 of those were more general professionals across Montana. And then 2 of those were tribal related stakeholders. And so from that, we've developed a stakeholder strategic plan summary of all the findings that we learned from that. And we're going to move into doing focus groups across Montana to really learn from the people in Montana what they want to see in this campaign and what resources are they missing, what look and feel for campaigns are they looking for. And so we're working on that now. And then we'll move into developing a whole communication plan that really shows what people in Montana said and their input on where we should go, into designing a whole campaign that's related to opioid and naloxone across the whole state. And so Anna, I'll let you kind of go ahead and give more information and whatever I missed too. So thank you.
Well, thank you, Michaela. You did great. I mean, this has been a long-term effort that Kaufman and Associates has worked with the Montana Department of Public Health and Human Services. This work is really personal to me. I lost my youngest sister to an opioid overdose. And so when we experience it at the level that we have, and I think now research is showing that, all of us, no matter who we are, if we live in urban areas or rural areas, on reservations, that this is impacting us. What I loved most about our stakeholder groups and, the combining of both, the indigenous population of Montana, the professionals of, that are working on this effort, is that they had a clear vision. And that was to have a holistic, inclusive, integrated approach. We heard over and over that siloed approaches don't work. And so we'll be really focusing on creating a holistic, inclusive, not one campaign for one group, but making it all fit together. They also wanted us to be sure to include youth, adults, and senior citizens, recognizing that impact affects us all. I really loved that they brought out that we needed to focus some attention on caregivers and first responders. So those people that see it, face it every day, and what can we do to help them? And finally, Michaela, what they told us is, let's get fentanyl out of Montana. And so, what a strong statement. And so as we build our campaign and work with DPHHS and the Montana Public Health Institute, we've got really clear direction from a great group of people.
So thank you, Anna, for that whole background on what we found in the stakeholder meetings. And so just to summarize all of this, we're really going to take all this information from the stakeholders and focus groups and really design a very strong campaign that relates to what the people are telling us they want to see and hear. And so we're going to move forward with developing and designing a campaign. And this will be digital, it'll be print, billboards, we'll have a social media campaign, and we're really going to work with a lot of different media organizations to get this information out there. And all of this information will be shared with our partners as well, with DPHHS and Montana Public Health Institute. And we'll be able to get this information across the whole state. And so that is our goal for this year, and then to continue to move forward and improve and increase what our campaign is for the years moving forward too. And so with that,
thank you for having us.
Yes, thank you all.
Thank you, Anna and Michaela. We're so excited to see this campaign unveiled, and we're sure all of your efforts will shine through. Our last pair of speakers, before turning it over to Montana Public Institute and seeing the virtual reality module, are Joel Rosette and Todd Wilson, sharing their perspective on services in Montana's Native American communities. Joel Rosette is the CEO of Rocky Boy Health Center, leading a team of over 180 employees to serve 4,000 people. Rocky Boy Health Center is guided by their vision of achieving a wholly healthy community. Their staff and clinicians maintain and restore health through leadership and compassionate care, modern practices and technology, community outreach and education, and the unique principles and traditions of the Chippewa Cree heritage. Additionally, Joel dedicates time to mentoring and developing youth through coaching basketball, and recently started a community nonprofit, Mamo Way, which roughly translated means everything comes together. Focusing on Rocky's Boys' tribal youth leadership, much like Joel's philosophy when coaching basketball, Mamo Way has a mission to build and translate youth experience into life and leadership skills. Joel received his business administration degree with an emphasis in management and marketing from the University of Montana. He obtained his Juris Doctorate at the University of New Mexico School of Law with an emphasis in Indian law. He's the owner of Joel Rosette Law, a tribal law practice representing tribal firms and entities. Todd Wilson is an enrolled member of the Great Crow Nation in southeastern Montana and serves as executive director for the Helena Indian Alliance, where he works collaboratively to improve and expand services throughout the community. Todd previously served in the health field and health administration for 14 years as the Special Diabetes Program for Indians Coordinator for Crow, as well as the Crow Tribal Health Director. He received his high school education at St. Labrie Indian Catholic School in Ashland, Montana, and his bachelor's degree in exercise and sports studies from Guilford College in Greensboro, North Carolina. He's the proud father of 3 children.
Yes, good morning, everyone. I'm glad you can make it. My name is Todd Wilson. I am the executive director of the Helena Indian Alliance in Helena, Montana. I am an enrolled member of the Crow tribe, the Crow Nation from southeastern Montana. And I've been working in my position here as the executive director for almost 6 years now. And I really enjoy what I'm doing. Thank you.
Dante Kiowell, Joel Rosette from Rocky Boy. I'm the CEO of Rocky Boy Health Center. That is the tribal FQHC located in central Montana, north central Montana. Serves about 5,000 tribal members with about 180 staff. I've been in the position close to 3 years.
Yes. So again, thank everyone this morning for joining us. And we just kind of wanted to touch up on our perspective in our communities, myself with the Helena Urban Indian community, as well as our just Helena community in general. And Joel just kind of touching up on some of the reservation aspect of some of this crisis that we're dealing with. We're seeing a lot of opioid use in the Helena community, and it's even turned a corner into fentanyl years before that, it's turning to fentanyl. We're going from meth, we're going from those smaller drugs, what we say now, into this the danger zone of what would be fentanyl. And I know in Helena alone, we had about 22 overdoses in the last 45 days from the presence of fentanyl. So it is in our community, it is here. We are trying to do our best to provide the educational resources and the classes and the preventative measures to better prepare our clients and our families for that. For the reservation part of it, Joel, what are you guys seeing there?
Yeah, thanks, Todd. I think we've been dealing with this crisis as well. Rural communities are seeing these same issues with fentanyl, with opioids for years, actually, and it just seems like it's intensified, not only with the pandemic, but overall with the times. It's more accessible. It's easier to get here on the reservation, and we've just seen a lot more from our MAT-assisted treatment program we run here on the reservation. More clients coming in, more people seeking. That's been the positive, that we've had more people seeking treatment for it and us having the resources like Narcan, making Narcan a easy to get within our community. We've created so our police department, EMS, all are equipped with Narcan, and providing that as a safety measure in our community for folks to prevent some of these overdoses that are taking place. So I'm really happy about our response, but it's been tough dealing with the rate of it coming and the complexity of it as well. We've tried our best to mitigate it by getting Narcan master trainers here to get into our schools, our casinos, our courts, so everybody has Narcan freely available to prevent these. So us responding quickly has amounted to these changes. Narcan becomes a normal part of the lexicon out here in Indian country. So I think that's been our best thing we could do to respond to it and educate our community.
Yeah, I'm glad you brought that up as well. We have our own MAT clinic as well here at the Helena Indian Alliance, and we've been running and operating a MAT clinic for about eight years now. All of our providers here are waivered because if we only had one waivered and something happens, we wanted to make sure that we had the coverage that is needed for our MAT clinic. And we also we provide the naloxone training on a quarterly basis here. And I'm sure you guys do too on the reservations, but we're doing a lot of these measures to make sure that we're helping the community, because it's very prevalent, not just here, but on the reservation. We've worked with various healthcare agencies, including the hospitals here, the hospital system, St. Peter's, our local FQHC. We work together collaboratively with their MAT coordinator, with ours, and their program with ours as well as the community agencies that are in town. And one of the primary goals of our program is I don't want our program to be a shop where you can come and you can get these these naloxone or Narcan or the Suboxone, all that stuff as you want or as you please. We actually want you to better yourself in weaning off of whatever substance it is that is bugging you or that you're on. So, we've done a lot of trainings where train the trainer site. So we get the master trainers. We have a master trainer, and we provide these trainings to our communities every quarter. And I think we provide about 150 a year since 2019, individuals that have attended our quarterly trainings. We've provided over 1,500 units of naloxone to the community to get those in the hands. And we make sure that people are aware that our program is available for that through radio ads. We do a lot of advertising, getting the flyers out, making sure people know that we are here for them in this round, because it's getting to a point where when I talk with our staff it's taking more than one dose of the naloxone to revive an individual.
Yeah.
And that is kind of scary to think about, where we get the packets out, there's 2 doses in there. But because of the high potency of the fentanyl, we have cases where they're taking 2, 3, or 4 doses in their timed increments to revive the individual. And that's what we're dealing with now. It's scary, but we need to be on top of what we can do and be there for the families and our community.
Yeah, I'm glad to hear all the work you guys are doing in Helena as well, and in the state of Montana for this. I think, you brought up a number of things, especially access. At times prescriptions were needed for the Narcan, but making it more accessible for people to come into the pharmacy and get those free of shame, because there's a lot of issues with that, because we'd rather they have them than not have them. It's a risk factor there. We know that, these activities are going on. So us to be proactive with that, making sure that it's freely available for them. And you brought up a number of points, because we're the same way as far as getting extra doses being needed. We're getting, people not making it because of these activities. Our EMS has been out there stretched, PD, responding to these emergency situations. And sometimes it's not always been a good ending for our folks. And we have to be proactive in this battle against these opioids and fentanyl, and just really push it that we're going to provide the best options for our community. And I love to hear all the things you guys are doing, and we're trying our best as well to battle this battle going on.
Yeah, it is. It takes the community, takes everyone, and as an urban Indian organization, we're kind of a melting pot of all of the tribes. Our biggest data source, our data usage that we've collected, Blackfeet and Rocky Boy are our 2 biggest users, as well as Little Shell in our facility. And those are the clients that we serve, and a lot of the community members that are Native American that come through those doors for that type of service. And part of what we do too is with our MAT, along with our MAT clinic, is we're part of a bridging community. We work with our local FQHCs, our local hospitals, and even our detention centers in these resources, and combining each other's strengths to combat this and doing what we can. And I think we have a really good story. I think this was told to me. We provide the training to the detention center staff. It's been hard to get into our local detention center, but we were able to work with them through this Bridging the Community program. We got into the detention center. We trained all of their staff on naloxone, got them trained. And right after that, there were 2 females that got arrested, and they smuggled in fentanyl, and they both simultaneously OD'd. And the staff recognized it, and they were able to revive these 2 individuals based off of the training we provide them. It was right after we were in there that this happened, and we were fortunate that we were able. The timing was ideal for that to be there and have that training provided for the detention center staff. And the other part is, we work with the local emergency rooms, because that's where a lot of them are ending up as well. And making sure we have the brochures available, we have handouts available, we have numbers available for resources in the emergency rooms and at the detention center for when they're released as well. So we're making sure that we're there for the community, we're there for those individuals, and that we're doing everything we can in our power to help those individuals and to help our community.
That's great. I think the partnerships are key, like you touched on. I think us creating this strategic plan overall for us to address this crisis is going to take all of our partners working together collaboratively to reduce these risks in our communities and to try to prevent these overdoses from happening, but also equipping all our community with all the tools, like you said. I'm excited that we're able to at least try our best to be out in front on this battle. And I think through these partnerships, we can only get stronger with not only tribals, but with urbans, with people in your community. So we're the same way. We got partners in Havre, which is a town about 25 miles with the hospital. So we have to partner with them and work with them so to prevent these instances with our community members. So
Yes. Well, thank you, Joel. Thanks for joining us on this. Thanks for joining me. And again, if you want to reach out to any of us, you can reach out to myself at twilson@hia-mt.org, and Joel at
Joel at rbclinic.org.
So yeah, thank you everyone for your attendance, and we look forward to hearing from you.
Thank you.
Thank you, Joel and Todd. It's impressive to see how we face challenges that are both similar and different in rural and urban communities, but that best practices in our opioid response activities truly bridge the gap. I'm excited now to introduce our last speaker and today's co-host, Holly Jort. Holly is a program officer with the Montana Public Health Institute. Holly is a registered nurse and has a Master of Public Health degree. She has 19 years of public health experience working in the areas of maternal and child health, immunizations, reproductive health, behavioral health, and addressing the social determinants of health. Holly has been offering support to the state opioid response grant and providing support and technical assistance to statewide behavioral health crisis systems since joining MTPHI in 2020. She is a native of Montana, living in Kalispell. We're excited to hear from you, Holly.
So I'd like to take a quick moment to thank all of you for participating in our webinar today, as well as the presenters for taking time to share their work and experience in opioid prevention. I'm Holly Jort, and I'm the program officer with the Montana Public Health Institute, and I'm here today with my colleague Heidi DeRouche to share more information about new regional opportunities for opioid education and naloxone distribution. The Montana Public Health Institute formed in 2020, and we're a nonprofit that's here to help build capacity in public health across Montana. One of our primary focuses has been in the area of behavioral health and building a continuum of care that's inclusive of prevention, crisis intervention, treatment, and recovery. And that's really led us to our involvement in opioid prevention in Montana and sponsoring this webinar today. So in an effort to better respond to opioid-related overdose in Montana, the Montana Public Health Institute is preparing to roll out a new hub and spoke model for opioid education and naloxone distribution across Montana. This will allow us to utilize the experts across Montana and to have better in-reach to people who use drugs as well as their family members and friends. Naloxone distribution will be a primary focus of OENDPs. However, we recognize that naloxone is not the answer. Without naloxone, though, many people might not get the opportunity to access treatment and recovery resources. Montana will continue to lose more of our children, our parents, our siblings, spouses, friends, and extended family without all of these resources braided together. Montana, or the OENDPs, will give a second chance and an opportunity to make a change and to find a new path for individuals. There are several objectives of the OENDP model. The first is to increase the number of people who are trained to administer naloxone. And then we want to ensure that there's equitable distribution of naloxone within each region across Montana. We'll increase access to naloxone to people most likely to witness an overdose in locations where overdose is most likely to occur. We'll help to maintain an updated list of active treatment providers. We'll utilize communication tools that are being developed by Kaufman and Associates to increase awareness, prevention, treatment, and recovery resources. And we'll make a plan to help notify regions of an unexpected increase in drug-related overdose in their region that occurs in a timely manner. We'll also provide ongoing training and technical assistance to counties within each region. So the purpose of the OENDP pilot project is to develop and implement a plan to increase opioid overdose awareness, to facilitate training for communities and professionals, coordinate access and distribution of naloxone within each region. And this will require a coordinated effort amongst partners within each region. The Montana Public Health Institute, as mentioned previous, will use a hub and spoke model to implement best practice and resource sharing through each region. The Montana Public Health Institute will be the clearinghouse of information and serve as the central hub for all of Montana. And then we'll support 6 regional hubs that have direct inreach and connections to local and tribal health departments, prevention specialists, treatment and recovery providers, and harm reduction organizations who are all well situated to have ongoing and frequent interactions with people who use drugs and their family and friends. The regions will follow the existing Montana health regions with the addition of one more region on the eastern part of the state to help divide up that vast area of land. So OENDPs should work with regional partners with the goal of increasing access to naloxone in the community setting by making naloxone available to people most likely to witness an overdose death or an opioid overdose. These regional partners could include area treatment providers, recovery services, first responders, mobile crisis response teams, local and tribal health departments, criminal justice partners, harm reduction organizations, schools, prevention specialists, medical providers, community health workers, amongst others. So our timeline for rolling out OENDPs and this pilot project is that by mid-March, we hope to have the funding notice released, and organizations and programs focusing on opioid prevention, treatment, harm reduction, and recovery efforts are really encouraged to apply. These organizations should have the capacity and the connections to allow them to successfully support their entire region. Funds could be used for an employee to coordinate the OENDP response. The application, when available, will be posted to the Montana Public Health Institute website. By early April, funding notices should go out. And then by May to June timeframe, we're looking to bring all of the OENDP coordinators into a regional or into a Montana training and launch. And then really looking ahead to September of 2024, that's when the funding will end. And so we're going to be working and supporting partners during that year and a half to help them really put together a sustainable plan for this project. If you have additional questions, we direct you to our mtphi.org website. And there you will find a drop-down that lists out our work, and you'll see opioid prevention listed there. Additionally, I've listed myself, my email and phone number, along with Heidi's email and phone number, and feel free to reach out to us with any questions about this work. Thanks again for joining us today.
Holly, thank you so much for being such a good friend of CADCA. Thank you so much for being our co-host tonight, for all of the work that you do in Montana, and for coordinating with us and making today's event possible. Thank you to all of our speakers. Each and every one of you are doing so much to raise awareness and expand services in this unbelievably challenging environment. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, which includes the use of virtual reality. The virtual reality program was developed as a tool for training to build skills in unique training situations that are difficult to replicate in classroom setting, such as Black Friday trainings. This technology led to the development of non-retail trainings, such as the VR we will see next. Please, let's take a moment to view this training.
Guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017. And millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency? Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, Make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to Walmart team for developing this powerful tool. We are excited to work with you to connect this to community members. Again, thank you to all of the speakers who are here today and have taken time to be part of this event. We're so honored to be working with you on this very important initiative. And now we are through the hour, and we want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and your insight. Please reach out to us at CADCA anytime with any suggestions and questions. My name is Reiko Mendoza, and you can reach me or any member of our team at rmendoza@cadca.org. And look for us to be reaching out to you as well. We're excited that you're here, and we thank you so much for being part of this event. We wish you a wonderful rest of the week. Have a great day.